Hi, I'm Dr. Harish K V. The commonest fevers that we see is viral fevers today. Most of them are viral fevers. And then next comes the typhoid, which is quite common. And then there is malaria is also has reduced a lot. And so the main viral fevers today we are seeing is common viral. Then comes which is flu. Then the next would go is dengue fever, which comes as seasonal, but still it's there round the year. Then we could also counter some hepatitis, which is again viral hepatitis A, which is waterborne. And I think these are the commonest infections or fevers that we see. And we also see a lot of urinary tract infections. It's more common in female as well as presence in male as well. 99 degree Fahrenheit is fever, but sometimes even in summer the body temperature is slightly on a higher side, or if you are on some drugs that can also increase the body temperature. Some drug abuses we see it's slightly on the elevated side. Unless you have 99 degree Fahrenheit with cough, cold, fever or other symptoms, then we can consider it as a infective cause and term it as fever. Fever can be removed fast by resting it out, wait for some time and try to do a lot of fluids. Antipyretics can be started. Paracetamol can be used to bring down fever. Foods that can be used during fever is foods that can be easily digestible, like you can use soups, clear fluids like tender coconut. Then you can have idlis, dosas, porridge and poha and khichdis. This will help you to ease out from your fever faster. Fever panel tests consists of complete hemogram, CRP, Widal test for typhoid, dengue profile for dengue, rapid malarial test for malaria, and a urine test to rule out any urinary tract infections. We also do a liver function test to rule out any viral hepatitis. The typhoid fever, the mode of transmission is usually it's a waterborne disease, usually contamination of water where typhoid is caused. It can also be caused by a typhoid carrier who can transfer it, commonly seen in hotels, or by food handlers who become typhoid carriers and they spread it. Otherwise, it's a waterborne disease transferred by water. Typhoid takes about 14 days for complete recovery. The duration of treatment would be about 10 days with antibiotics. 2 weeks is complete remission. It has to be followed for relapse of typhoid fever at least once a year. Best is to give a vaccination, a typhoid vaccination every year for the next 3 years so that you don't get a relapse of typhoid after having a typhoid fever. Pneumonia fevers are usually they present with chest pain, cough, high fever with chills. These are the symptoms that are seen in pneumonias. Either it's viral pneumonia or bacterial, the symptoms are the same. The pneumonia fever lasts for about 5 days to a week based on the severity of the infection and also based on the immunity of the patient. Measles is a viral fever. Measles can present with rashes which takes about 5 days to 7 days. It can extend up to 2 weeks, again based on the immunity of a patient. It is usually symptomatic line of treatment. Commonly it causes complications like orchitis in male, and sometimes in very rare cases it can also cause encephalitis, viral encephalitis. It has to be well managed and treated early. As I told you, viral encephalitis can be a serious condition. Rest of the complications are well managed like orchitis or any skin related changes or lung related changes. It is not so serious, but if it's viral encephalitis, then it has to be addressed at the earliest and treated well so that we don't see mortality. Dengue is a viral fever caused by a mosquito bite. Usually it stays about 5 days to 2 weeks. The platelet has to be monitored where there's long thrombocytopenia that is there. It is a self-limiting disease which is managed by treating the platelets and the symptoms that are produced by dengue fever. Usually dengue fever does not spread person to person. Very few research have shown that it can spread but it's very minimal. Usually dengue does not spread from person to person, but it can spread if there are mosquitoes and if a patient is there and a mosquito biting an infected patient and biting the attender can cause, but direct spread of dengue is not there. Rat fever, otherwise called as leptospirosis, that is the urine of a rat contaminating the food or the eatables, causing rat fever or leptospirosis. It is treatable. You have to do a blood test called leptospira IgG IgM, and they are treated with antibiotics. They are well treated. It also brings about changes in the liver enzymes and LFTs, which has to be monitored. It is treatable and it's well treated.